Early in the conversation, you mentioned the fact that when the enamel is gone, it's gone, or something along those lines. When we're talking about nanohydroxyapatite, it sounds like that can remineralize. Talk about the nuance there.
The mechanism of nanohydroxyapatite is still not fully understood. We do know so it's calcium and phosphorus particles. They do fill in the microporosities, and they're so small they can get into the tubules. What we don't understand is how are they staying there, but I will tell you clinically, they do. And so this is still an area of science and research that we need to fully understand. Is it electrical charges that are interacting with other, or new bonds being created? It just hasn't been studied enough on that level of detail, but it will fill in microporosities. This is why many patients not only will see their cavities arrest or remineralize, but also their teeth might look brighter and whiter, because if you're creating a nice smooth surface, it's the way the light reflects and refracts, it will have a different glow to it, a different brightness to it, because you've taken away that bumpy surface and created a nice smooth surface too. So yeah, it's one of those areas we need more studies. So we can't grow back our natural enamel, but we can kind of replace it now with this nanohydroxyapatite, which is as close to enamel as we have.
And what's the furthest along the tooth decay spectrum you've seen somebody use a product like the nanohydroxyapatite to remineralize and regain the integrity of that tooth?
So there's two different things. There's remineralization and then there's arrest. Okay, so remineralization is truly filling in that hole. So what is a cavity? It's a hole, cavitation. So you've lost so many minerals at some point that the tooth literally kind of like breaks in on itself or creates a small indentation or hole. And unfortunately, that really can't easily grow back together unless you create some support for it and make changes. And this is where lifestyle changes, hygiene practices, diet, and nanohydroxyapatite can make a difference. So if you're trying to remineralize, I've seen it most successful if you catch the cavity still in the enamel. Okay, because this is the mineral dense layer of our teeth. So at that point, I have seen complete reversal. And I see it a lot in the pediatric population. It's a really cool thing to see. If the cavity now gets into the next layer of the tooth, which is the dentin, most dentists will say, nope, can't do anything, have to do a filling. I politely disagree. Now, there's a lot of factors that go into this. Like, is the patient going to make changes? Are they going to start flossing? Are they going to cut back on their goldfish cracker habit, et cetera, et cetera? But I've seen arrest of those cavities. So that means you'll still see it on an x-ray, maybe as a shadow, or you might even still see it in the mouth as an indentation, but it gets hard. It gets rock solid hard. And that means it's no longer progressing. It's kind of petered out, if you will. And so then you just need to decide, well, now is this hole, is it trapping food? Is it an aesthetic issue for me? Or is it fine if I just keep it clean? Will it stay arrested? So there's a big nuanced difference. And there's a lot of factors that go in as a provider determining when it's appropriate to try to arrest a tooth or not. I do this a lot in the pediatric population because these teeth are going to fall out. So, if I can avoid an invasive procedure on a child, especially a fearful child that might generally require anesthesia to get something done, if I can instead maybe arrest the cavity or at least delay its and slow down its progression until the tooth falls out, then that's a huge win. So yeah, I think we can't forget the power of arresting a filling. The way I like to describe this to patients, so when I take my little pokey tool, my Explorer, if I touch a healthy tooth, it feels like if you took a pin and touched it on a mirror. Okay, so it's hard. An active cavity is like if you took a pin and stuck it in a raisin or a date. Like it really does stick. It's sticky, it's soft. But if a tooth is arresting, not fully arrested, but arresting, it feels like if you took a pin and like touched it upon leather. So it's kind of tacky. You're not going to stick in it, but it's kind of tacky. And when I see that, if I go from a pin stuck in a raisin, and then the next time I see the patient for a follow-up, that cavity now is like a pin touching leather, I know that tooth is in its process of healing. And then once I come back and if I touch it and now it's rock hard, that's arrested, that's healed. And I do see this, our body is pretty amazing. It can really heal itself if given the right circumstances and opportunities. And sometimes it needs a little boost, like with prebiotics, probiotics, and hydroxyapatite.
All right, hypothetical situation. You found a small cavity in your enamel. You wanted to throw everything you know at it to try and arrest and reverse that. We know the hydroxyapatite's a piece. You mentioned this varnish you guys created as well. What are all the different adjuncts you'd bring in?
This happened to me. In 2015, I had my second daughter, and then I went in maybe 6 months later to my friend, and they took bite wing x-rays, and he missed it. He was like walking in and walking out, and I looked, and I was like, I have an incipient lesion on a premolar. So I had to start a cavity in between. It was actually a couple teeth, very small, but it was there. And he said, he was a very traditional dentist, my buddy. And he said, let's get you back and fix it. And I said, no, thank you. I hadn't had a cavity since I was 6 years old at that point. So at the time I doubled down on, I don't know. Yeah, I was using Boca at that time. So I think I was using Boca in between. My protocol now is I want to try to kill bacteria and strengthen the tooth. And we don't do this forever, but maybe for a month or two. So I use a lot of ozone products. So I use ozone oil. My patient protocol is take some ozone oil. Let's say it's a cavity in between the teeth. Put a little blob on your floss it in between, go to bed. Don't rinse, don't eat, nothing. And then the next night, do that, but with the varnish that we've now created, the FIG varnish. So it's the prebiotic, oral microbiome modulating, high octane nanohydroxyapatite, professional strength. And again, the data on this now, we're just so happy with it. It's really, we're very proud. So you can put a blob of that on your floss and floss it up in between, like really glob it up in there and let it sit. Don't rinse, don't eat, let it sit there all night. If you happen to have Invisalign trays or something, like retainers, you can also put a little bit in there and that will really adhere it and keep it close to the tooth for a long period of time. So that essentially is my protocol, for actually creating or giving medicament, if you will, to the area. But there's now lifestyle factors too. So we have to be committed to making dietary changes. And maybe this isn't forever. This is like when you do, let's say, an elimination diet. The goal with these things is not to keep the patient on this extremely restrictive diet forever, but we need to kind of clean things up a bit so we get back into a state of harmony. Okay. So it's the same with your saltine or Ritz cracker habit that you might have. I would say we need to cut that out right now as I'm trying to heal these cavities. Are you committed to that? We need to get back into prebiotic rich foods, eat the rainbow foods, meats, vegetables, fruits, nuts, and seeds, things from farms and not from factories. Are you down? And hopefully they say yes. We have to get mouth breathing under control too. So if you breathe through your mouth, we mentioned earlier in the show, your mouth will dry out and become acidic. And so it's an uphill battle. So we have to get airway under control too. And that might be lip taping if you're eligible for that. Or working with a myofunctional therapist or an airway trained dentist or seeing an ENT. And then I can't emphasize hydration. Your saliva is a big part of this. It's the golden elixir of our body. I think we just take it for granted, but it has all these healing factors, growth factors, immune factors, ions, minerals, all of these important enzymes and things. And so we need to stay hydrated. We need to stay very hydrated, and we need to make sure we're optimized in minerals and fat soluble vitamins. And this is what Western Price speaks a lot about. Is making sure, our vitamin D, our vitamin K, our vitamin A and E are optimized. And then also, are we getting enough magnesium? Are we getting enough trace minerals? These things are important for salivary health. And so we go into this a lot with families. So I'm spending a lot of time educating and almost health coaching families to get through this cavity healing process. And it works. I will tell you, it works. But I understand not all dentists have the capability to go into this level of detail. They don't have a practice model where they can spend as much time with their patients. And that is why, Dr. Berhana and I are committed to creating educational platforms on social media. We've done a few courses. I lecture a bit, and in hopes to help get this information out there, because a lot of it are things you do at home. It's not things that we need to be doing in the office. So yeah, it's the ozone nanohydroxyapatite protocol and then lifestyle changes too. And it can be very successful.
All right, coming back to your story, no longer hypothetical. What happened when you applied all this?
To my teeth?
Your two, it sounded like it
my
might
cavities,
have had two cavities.
Gone.
Yeah.
They're totally gone.
Amazing. How long did that take?
Yeah, that's a great question. I'm not the best patient, so I'm certain I didn't go in when I was supposed to. I usually see remineralization in anywhere from 3 to 6 months, depending on the extensiveness of it. If it's a really deep cavity and we're just trying to arrest it, it can take longer, up to, I would say, a year. But mine, it didn't take very long. We noticed it was gone at my 6-month follow-up. However, I don't think I went in at 6 months. I think that's what I'm trying to say. I probably went in at 10 months later and it was gone. And I was taking x-rays in between at my own office and kind of seeing it fill in. So it was small. We caught it early, but usually 6 months is a pretty good time, 3 to 6 months. Because think of it like bone healing too. Like if you've broken a bone, how long does it take to heal? You might get your cast off in 6 to 8 weeks, but is it truly, remineralized and recalcified? It can take a few months to see some of these things. And again, there's so many variables that go into this. So trying to find out what the true root cause of your issues, that's the most important part. Like, why do you have this going on to begin with? Is it because you suck on candy on just the side of your mouth every day from 1 to 3 p.m. at your Zoom meeting? Is that why you have issues over here? So that's the thing we need to change. So this takes time to talk to patients and explore their antecedents, mediators, and triggers and things, but you can kind of be your own dental investigator too and say, yeah, I'm terrible at flossing and I eat a lot of fermentable carbohydrates. Yeah, I know I breathe through my mouth. Yeah, I never drink water. I'm probably dehydrated.
And how different was your oral health routine back then versus now? And what do you think it was in your case that caused this?
So I wasn't tongue scraping then. I don't think much, to be honest. I think it was my pregnancy. So people poo-poo this, that moms say, I got my first cavity after I had a baby, or my teeth shifted and moved, which that's a hormonal thing, or I have, bleeding gums, that's hormonal. Our bodies take a toll. And so I do know I had my children pretty close together. I did not properly support myself with my first pregnancy or after. I was working a lot. I was very unhealthy at this time. Very inflamed. I had terrible gut dysbiosis. My hormones were all over the place. And so, if we're not optimized with our minerals and vitamins ourselves as a mom, I really do believe that our babies will take every last bit from us, and then what we don't have will be depleted. And so I see a lot of women get cavities after they've had a baby. And so I believe that's what it was in my situation, certainly.
You named a bunch of different vitamins, trace minerals. How do you look at somebody getting those within the diet and then supplementing on top of that?
So to me, the most important is vitamin D. I wish we all knew our vitamin D levels annually. It's really, I don't know how it is in Canada, but it's really hard to get a doctor to run a vitamin D panel on you. You have to ask for it. It's not covered by insurance usually, which is just ridiculous. But I love test, don't guess, because so many families will come in and say, well, we take vitamin D. And then if you actually test their child, they can be extremely deficient. So they're just not taking enough. Now, perfect world, I wish we could get outside, optimize the sun, and get vitamin D from the sun and maybe, through the vitamin D2 conversion through diet. But I've just found so many patients can't achieve that. They just have too hard of a time optimizing. And this is why I like to test. And I've done pilots in my office where I'm vitamin D testing, like a blood spot test of children undergoing anesthesia. So they have rampant decay usually, and quite close to 100% of them are extremely, almost rickets level vitamin D deficient, like single digits or in the low teens. The parents had no idea. So the things I talk about most with my families are, I really want you focusing on vitamin D3 and K2 and magnesium. I don't like to overwhelm. So I said, those are the most important. We know statistically, globally, we're deficient on a population level for all of these things. So if you can get a quality magnesium blend, maybe some trace minerals too, and then a D3K2 combo, ideally like in an oil of some sort, in olive oil or some carrier that's fat soluble. That's ideal. And then just try to get outside as much as you can. Don't fear the sun. Don't slather on the sunscreen the second you get outside. Like, maybe allow your skin to be in touch with the sun for a few minutes. I know this gets controversial, but it is how I feel, and then you can put on your mineral-based sunscreen after. But we're just inside so much. And then we can get into like quantum physics and light and what all this artificial blue light is doing and how that's affecting our biology and our circadian biology. And there is some research to show how photon energy actually impacts enamel formation and tooth formation. We do know microplastics in the environment are affecting enamel as well. And that's something I would love to speak about in a moment. But I again, getting back to the vitamins, eating a nutrient-rich diet, ideally, I'm hoping you're eating animal meat, animal protein, high quality. But if not, you really need to focus on supplementing as necessary. I like a high quality multivitamin as well. I like desiccated organ capsules too, for those that resonates with, to get all those different elements and trace minerals in. But I find most humans are deficient. Most of the kids that come see me are deficient. I work very closely with functional medicine doctors and naturopaths, and so we have data to show that. And if they're starting to get cavities, again, we're so focused on hygiene in dentistry, but these patients can be doing everything correctly. Some of them are even eating decently and they're just still deficient. And so that's affecting their teeth. And then that could be like a bioavailability issue. Maybe they have intestinal permeability. Sometimes we've missed like a celiac or gluten sensitivity in these patients, and they can have a lot of issues with their teeth too. So there's just a lot to uncover. But I think a lot of gut health when I think of my kids too, and how are they absorbing their nutrients, if they're even getting enough.
If you enjoyed that clip, you're going to want to head over here and catch a full episode. I'll see you over there.
Something that quite literally keeps me up at night, I'm very worried about it. I think it's a global epidemic. Not many are speaking about it. It's something called enamel hypoplasia, or it's basically undermineralized enamel.